Welcome to today's webinar. Today, the topic which I have chosen is establishment of a blood component facility. Now, almost every blood bank make it. They have made it compulsory that all new blood banks will have a blood component facility, especially with the spread of dengue fever. A blood bank is an area of a hospital where human blood is collected, processed, stored, issued for transfusion of patients, ensuring safety, adequacy, and accessibility of blood supply in a cost effective and coordinated manner. Actually, in many places, the transfusion medicine departments have opened up, but in more than 90% of colleges, there is no sign of any transfusion medicine specialist, and for next 10 to 20 years it appears that the number of seats are so less that this situation is going to continue, and the blood banks are going to be managed by pathologists themselves. And in most medical colleges the blood bank is directly under the administrative control of the pathology departments. So basically, we have the various models of blood transfusion service: the hospital-associated blood transfusion service, and the government-associated blood transfusion service, the Red Cross blood banks, the private blood banks, and of course, in some countries there is a mixed under public-private partnership. So the blood component usage has evolved over the years. I remember there was a time when anybody could open a blood bank, and outside every hospital, in very dingy shops, the blood used to be taken, and with very little testing, it used to be transfused. And the ABO system was discovered in 1900, and initially only whole blood was collected and transfused, and the PVC plastic bag has come in the late 60s, and then component separation has come in 1970s. And after that, the advent of automated cell separators, it has led to development of a number of subspecialties in which platelets and which are mainly used by oncology department. The DIC treatment has evolved with the plasma separation, and hemophilia patients have been treated with the help of cryoprecipitates. So India has now a huge population, and there is a requirement about 1200 million, and they of is being catered by a million bed strength, and there's a gap of about 3.5 million units, and this gap can be filled with only with the help of the actor donor motivation and making the best use of a blood bag that is into RBC, WBC, plasma, platelets, so that one bag can help four patients. So, component separation is one way by which we can help filling up this gap. And at present, out of the 4 million units collected, about 4 lakh components are being prepared. So, there are various blood bank types. Majority are still government, and though advent of private blood banks is coming up. So to establish a blood component facility, a license has to be taken from the Drug Controller General of India under the Ministry of Health and Family Welfare, and the Form 27C and 27E, accompanied by a license fee of 6,000 for 5 years, has to be applied. Now, an additional space of 50 square meter is needed for blood component, besides the 150 square meters for a normal blood bank. Competent technical staff consisting of at least one person who is whole-time employee a medical officer who is an MBBS and has experience of minimum 6 months in blood banking. Uh, and now it is that it is compulsory that he should be a pathologist or a microbiologist or a blood transfusion medicine specialist. This 6 months as a medical officer is only where in remote blood banks, which are running for long periods of time. And the newer blood banks must have a pathologist, and there should be adequate space and adequate arrangement of storage of human blood components and blood products. While opening, we should know the geographical area to be served, the population, the communication and transport, what is the previous blood usage in that area, the category of the hospital, the total number of hospital beds available, and of course, while designing the premises, there are certain activities involved, which mean that the equipments, reagents, consumable, staff, etc., and provide a good working environment and all the activities in accordance with these requirements made by the drug controller authorities. Now, I am just showing you a movie clip in which the entire component process is being shown. With the help of this movie, I will explain the process of a component separation. So, firstly, when the weight of the person is taken, and it should be minimum 45 kgs now. Earlier, it was a minimum 50 kgs, but now it has been reduced. And sample is the blood is taken, and this is the copper sulfate. Camp areas, it is copper sulfate is used, and if there is tips, then it is for screening purposes. Then now this is an instrument. This is, you can say, this is a quite often used. Go back. Now this is being an instrument which is dry chemistry. This also uses hemoglobin levels with the help of a strip, quite often used blood banks. And here on the strip also Drapkin solution is placed, and with a drop it can measure the optical density. And so ideally these days all reports need to be computerized. All the information of the donor has to be computerized, because quite often our national blood transfusion center, it makes the people, lot of donors, they come even after 3 months, and now it is that this blood has to be compulsorily voluntary. Not even replacement blood is not allowed, because a lot of people, it is found that if replacement blood is taken, quite often a lot of donors, they hide their information. So to prevent the tendency of people to hide their health information, it has been made voluntary, only voluntary donation. So the donor is screened, and a number of questions are asked to him by a medical officer. His history of fever, his history of jaundice, diabetes, and blood pressure, or if he's on any other drug, his or her sexual history, as well as, and this history has to be taken in a place where he is away from rest of the, I mean, his privacy has to be maintained. Now, if you see here, now this is the nurse, and she is applying barcodes on all the blood bags, and this is a triple bag. If you see the blood bag, it is a triple bag having a three one for components, one for the plasma, one for platelets, and one for RBC. And she is right number on all the bags. Along with this, the barcode. Barcode is one way, because it has been said that the commonest cause of blood transfusion reactions has been found to be wrong labeling. But barcodes, they prevent this kind of a mistake. So blood bag is, the patient lies down on the bed. The donor lies down on the donor chair. His legs are kept raised, so that the blood supply to the head remains adequate. The needle is inserted in his brachial vein. Now here from inside to outside, he's cleaning from inside to outside, and so that it is properly septic measures. And on the first prick, the blood must come, and it must collect within it. Very important, because if this precaution is not taken, then the platelets will stick to the sides. Platelets, where the yield of platelets falls. Weight of the blood is 1.1 grams per ml, and there a weighing machine. It is a weighing machine, and which when the blood completes. So now see, he is taking the sample in a test tube, and also this test tube is there's a long tube which is cut from the tip of the blood bag. So is kept separately. The patient, the donor is though these days it has got more a psychological value, they say, because giving one glass of juice doesn't make any difference, but it gives a good psychological feel to the donor that blood collected bag reaches the area where testing is done in the blood bank, which is in this area. No entry of the general public is allowed, and there is complete aseptic procedures are done. These area, so see, this person is taking the blood, and he has kept all the bag containing blood on one side, and empty bags on the outer side of the centrifuge, the cryocentrifuge. Similarly, he will take another bag in which the blood will be kept on the inner side, and the other bags, the empty bags, they are all kept on the outer side. This precaution is very important, because when the centrifugation is done, if this precaution is not followed, then the blood will get hemolyzed. Now bags are being balanced. The two sides. Now these are not. He's applying weights. Each weight, there should not be a difference more than 10 grams between the two sides of the blood bag. And now he will take them to the cryocentrifuge machine. Now here see, the temperature is at 4 degrees centigrade, and it will be closed, and first a soft spin is given at uh, which is usually there's a computer program machine. Soft spin is even slow means about 3500 rpm per minute, and so different machines have got an R value has to be calculated depending upon the size of the arm. So different machines have got different speeds depending upon the length of the from the center to the periphery. So in this, if you see that plasma is collected at the top, and packed RBC are collected at the bottom, and in between there is a white area where we have got large number of collection of platelets. So first of all, we will remove the platelet rich plasma at the top. For this, there are two types of machines. One is the automatic and one is the manual. So first we will see the automatic machine, in which separate bag is taken, in which segum is one material which provides nutrition to the RBC, and it is being placed in small segments. This automatic sealers. So as soon as the this platelet plasma is and packed RBC are separated, it will automatically seal all the tubes, the tube containing the packed RBC pressed, and the machine is pressing it. It is controlling this how much pressure is there in this. The program is it is pre-programmed that the pressure will increase slowly. For this, a manual system is also available, in which a person presses it slowly. Now he is breaking the tip of the segum bottle, and platelet-rich plasma is getting collected in the top bottle automatically. It will seal as soon as it reaches the top. So the area where platelet-rich plasma that has been sealed and the RBC are reaching the bag in which Segum is there. Segum provides nutrition to RBC. So we have a bag of platelet-rich plasma and the Segum bag containing packed RBC, and this has been emptied completely, and the sealing has been done automatically. Now this is a bag containing platelet-rich plasma and bagged RBC containing bags. They are made to suspended so that all the Segum comes down. Now see, now you will make all the RBC go into this bag and then seal it. Now, you see, the tube contains, this is a machine which multiple sealers. So he's sealing, multiple seals are being produced so that only a small portion of the tube is used for while testing. If a donor comes, only a small portion of the tube will be cut, which has been sealed. Now, this is a machine in which if we want to make platelet-rich plasma, we'll just put it, and this freezes it at minus 30 degrees centigrade in a very short time, about minus 56. Even minus 30 is okay, but minus 56. And these are the color codes: blue for O, yellow for A, pink for B, and white for AB for platelet rich plasmas. Now, after this, if we don't, we want to have hard spin. Okay, this is a demonstration of the manual method of separation of this machine is operated manually. This is quite cheaper than the automated machine, and as soon as he breaks the tip, the plasma will start coming in the second bag, while packed RBC will stay in the original centrifuge bag. See, blood is coming at the top. And as soon as it reaches the top, the person stops it manually. He has sealed the platelet rich plasma bag and RBC, and he is shifting Segum into the uh, bag manually. Now we have got a bag in which he's sealing it with an automatic sealer. Now the next step is separating of the platelets. See, again the process is similar. Another spin is usually given, and on giving the second spin, the platelets they come at the bottom. So formula usually followed is number of hospital beds multiplied by 6.7 is usually taken as the approximate requirement of blood units, and it is generally taken that 2% of the population in defined geographical area will require blood, and the routine hospital, according to WHO, the routine hospital requires 7 units per bed per year, and a tertiary hospital requires 20 units of blood per bed per year. So there are definite specifications of area to set up a blood bank. The building should be attractive, accessible, hygienic, durable, and the donor area and phlebotomy area need to be created. The administrative and staff clerical area, processing and storage area, lab, ancillary area should be there. The total area required should be 100 square meters with additional 50 square meters for preparation of blood components. And so this is the guide to the space and area requirement. The reception room should be about 25 square meters, and if for 10,000 and blood collections per year, bleeding room should be 55. 10,000 is the usual standard. Refreshment area 23, kitchen 5, if FRSL lab, if it is there, 40 square meters. The TTI lab or transmission transmitted infectious disease lab should be 20 square meters, and the component lab should be minimum 25 square meters, and but overall the size of the blood bank should be 50 square meters extra if this is for a component lab, and the medical officer room should be 15 square meters, social worker 30 square meters, the issue counter 18, washing room 20, a toilet of 5 square meters. I mean, these things are requirements, the definite requirements of medical officers, nurses, social workers, donor room, etc., etc. So there is a definite. The whole blood should be is unseparated blood collected into an improved container containing an anticoagulant preservative. This is usually the now it is a plastic PVC bag. The blood product is any therapeutic substance prepared from human blood. In fact, blood is now considered a drug, and blood component is a constituent of blood separated from whole blood, such as RBC, platelets, and plasma. And plasma derivatives are human plasma proteins prepared under pharmaceutical manufacturing conditions, such as albumin. Most of the blood banks, they produce so much of plasma that they are not able to consume. So a lot of pharmaceutical companies, they buy from the blood to produce albumin. Component versus fractions. A blood component is a part of a single unit of blood which is separable by physical and mechanical means such as centrifugation. A platelet-rich a fraction fresh frozen plasma. A fraction is a blood product which is separated from a large volume of pooled plasma, which can be called as fractionation, such as albumin, human immune globulin, etc. So, the potential of human blood that it can produce packed RBC, which increase the amount of RBC after trauma or surgery to treat severe anemia, and the fresh frozen plasma is to correct a deficiency of coagulation factors or to treat shock due to plasma loss from burns or massive bleeding, and it can be kept the packed RBC can be kept up to 42 days in a refrigerator at 4 degrees centigrade or up to 10 years in a freezer at minus 70 degrees, and the fresh frozen plasma can be kept up to 1 year in freezer at minus 70 degrees, and the platelet concentrate, it has to be it is used to prevent bleeding due to low platelets levels, quite often used in dengue fever and anti-cancer therapies. And it can be kept at 5 for 5 days, and where it is kept in a constant vibration state, 40 to 60 vibrations per minute, and cryoprecipitate is used to treat the fibrinogen deficiency and can be kept up to 1 year in a freezer at minus 70 degrees centigrade. So the blood components are basically oxygen carrying components, that is the red blood cell components, leukopo. These days, machines have come which remove the leukocytes from the packed RBC because they say that the leukocytes they cause pyrogenic reactions, so we get leuko-reduced red blood cells. Then there are platelet products like platelet-rich plasma and platelet concentrate, and plasma products like fresh fusion plasma, cryoprecipitate, and stored plasma. The plasma derivatives are factor VIII concentrates and factor IX complexes, and oncotic agents like albumin, plasma protein fractions, or immune globulins or Rh immunoglobulins, hepatitis B. The main key to a component lab is the type of hospital which and bed strength. It should be there, an adequate, well ventilated, air conditioned space. In fact, sometimes we say that in the late 90s, blood bank used to be the only place in the whole blood hospital which used to be air conditioned. Now, air conditioning has reached almost all areas, but in early 90s and late 90s, only the blood banks used to be, and we used to say that staff of the blood banks should make an HIV mandir in the blood banks because it is because of the HIV infection all the blood banks have gained importance, and they have all become air conditioned, and regular inspections are being done. Good equipment should be there. Double, triple, and quadruple bags should be available, and there should be a license from FDA and drug controller, and a good quality control program should be there. And most importantly, a motivated blood donor should be there. So weight more than 50 kg. Now it has been reduced further. The hemoglobin should be more than 12.5 gram the deciliter. Normal BTCT should be there. No aspirin. On a single veiny puncture, less than 8 minutes of bleeding time should be there, and there should be frequent mixing. For components, there should be a refrigerated centrifuge, deep freezes of minus 40 and minus 70, a platelet shaker, a laminar airflow bench to prevent infection, refrigerated water bath, weighing balance, plasma expressor, tube sealer. At some places, gamma cell irradiators have also come, and apheresis, where we have got patients who will be requiring cardiac surgeries, or we need quick transfer of platelets from donor to patient. Plastic blood bags have become compulsory. Double, triple, quadruple. There should be a closed system. They should be with high-speed centrifugation, unbreakable, withstand low temperature storage, easy to transport, and they are economical. Plastic blood bag and component separation. This shows a manual machine, and the triple, single bag, double bag, triple bag, quadruple bag. They are all available. The quadruple bag also helps in separating the WBCs. Flow, the donor selection, the blood collection, component processing, and the testing of labs, blood grouping, transmission, TTI lab, or transmission, transfusion related infections. And if there is a positive, it is kept in a quarantine, or if it's clear, then the plot, and then it is stored. If it is quarantined, the patient is tested again, and after that it is thrown. If it is test positive again, donor selection is done if there is some problem in the transmission TTI lab. The documentation of all this process is very, very important, and most of the inspectors who come, the blood bank fails or is passed based on the documentation. The inspectors spend maximum time in checking the documentation. So this is the weight of the blood, the various on centrifugation, the various RBC and neutrophils and platelets and plasma, they have got different densities and they separate at different speeds. So when the blood bag is centrifuged, the RBC are at the bottom. Above them, there are leukocytes, and then there are factors and fibrinogen and albumin on top. So frequently used terms in component separation: the holding time, the G force, or the amount, depending upon the length of the arm of the centrifuge machine. The hard spin is the faster spin, soft spin is the slower spin for RBC. Buffy coat is then the component separation C are there. So light spin is for short time at low RPM, usually done for RBC, and heavy spin for platelets. With low spin, the RBC are separated into packed RBC and platelet-rich plasma, which is again separated to high spin. When fresh frozen plasma and platelet concentrate is separated, and if we give the high spin directly, then RBC and platelet poor plasma is there, and which is frozen at minus 30 degrees centigrade, and it is thawed for preparation of cryoprecipitates or factor 8 plasma and for fractionation. Protocol for preparation of platelet-rich plasma is: first we give it the first spin 1800 rpm for 9 minutes at 22 degrees centigrade to separate RBC, and platelet-rich plasma, which is given a second spin at 3000 rpm for 7 minutes to produce the fresh frozen plasma and platelet concentrate. So this is the RBC. It is separated into first packed RBC and platelet-rich plasma, followed by the platelet-rich plasma reaches the second bag, and which is again given a spin in which the platelets come to the bottom, and ultimately the platelet concentrate and plasma is created. And in the centrifuge blood, the RBCs are at the bottom, followed by Buffy coat and plasma say at the top. This is how we usually do in the Wintrob's tube also. So this is the for preparation of low platelet product, RBC and platelet concentrates, where we don't have a machine. I mean, this was the method earlier in which first the first spin, and then in which the Buffy coat is separated, and then in the second spin the WBC and platelet concentrates are prepared. So this is an automated machine which is now available, in which but at many medical colleges this is also not available because it is very expensive. The life of the this question is quite often asked in the Viva, that what is the storage temperature of packed RBC? It is 2 to 6 degrees centigrade. Shelf life is 35 to 42 days, and ABO compatibility has to be done. The fresh frozen plasma is stored at minus 18 degrees centigrade. Shelf life is 1 year, and ABO compatibility has to be done. The platelets are stored at 22 degrees centigrade for 5 years, and ABO compatibility is preferable. And the cryoprecipitate are stored at minus 18 degrees for 1 year, and any group can be used. And cryoprecipitate is also kept at minus 80. So the labeling of this has to be done very well, and because quite often the labels are necessary. So this presentation was taken from SGPGI in Lucknow, and the entire video has been prepared in SGPGI Lucknow. The RBC components are packed RBC, leukoreduced RBC, and irradiated blood cells. And platelet components are random donors, are prepared from random donor or a single donor. The computerized blood banking information system these days is very. Earlier, I was in Haryana where they have networked all the blood banks in the state. So, if you have a shortage of blood in at one place, you can get it from any other place. And also, because it is linked to the identity of the donor. So a donor cannot donate at one blood bank on one day and on the next blood bank on the next day. So by networking of blood banks. This method is moving, and there is a goal of that all blood banks in the country, they need to be interconnected by a computer network. The work on this has already started, and most of the blood banks, at least in some states, especially Haryana, they have they are well on their way to through a website. They are networking. The software has been provided to all the blood banks. These are the various modules in the software of the blood bank, which links it to the hospital information system. So ultimately, setting up a component facility is not a one-step process, and the license has to be obtained from the appropriate authority, and component preparation has to be done as per recommended guidelines, and a quality control program and standing of SOP operating procedure has to be in place. Thank you.